Good morning, everybody, and welcome back to the second day of the NF Summit 2023. A few notes of housekeeping before we get started. We encourage you to continue to use Whova, the app that was created for this, and I use it constantly. I love it. You will find the agenda, maps, listings of local restaurants, and Q&A for each session there, so please use it. Also, visit the learning wall at the registration desk out here and fill our wall with everything you are learning and experiencing here. Today, we're excited to bring you our clinical care thread as we turn our attention to the ways living with NF can impact your health. We are pleased to begin with a conversation about healthcare access. So thanks a lot. Have a good day, everybody. Thanks.
We are going to talk a little bit about our adult pilot project for the NF Clinic Network, and you're going to hear a little bit more about our NF Clinic Network. I know there's some questions that came up about that yesterday as well in our initial plenary session. So I'm Michelle Pupizny. I'm the Chief Advancement Officer for the Children's Tumor Foundation, and delighted to be here with all of you. And we have an amazing panel. Tina Rosser and Justin Jordan, who are on our clinical care advisory board and are actually helping to lead the adult clinic pilot program with myself and Heather Radke, who may or may not be in the room, but I'm hoping she's here somewhere. And then we have two adult patients who are joining us. Katie Holt, who you'll see on your screen, but also we have the amazing, wonderful addition of Joe Jaffa. And Katie and Joe actually are patients at our two pilot clinics at UAMS in Arkansas and UCLA in Los Angeles. So we're thrilled to have them, and thank you, Joe, for joining us at the very, very last minute.
You're welcome.
Okay, so first I'm going to talk a little bit about our clinic network. I think many of you probably see doctors within our clinic network. There are some, I know it came up yesterday, about what do we do if we can't get to a clinic network, and I'm going to just tell you right now, let us know if you want to see somebody within a clinic that's part of our NFCN. Let us know. We'll help connect you and do the best that we can on that side of it. But the clinic was established in 2007. Ultimately, our goal is to standardize care for our patients. And as you can see today, throughout Canada and the US, we have 69 sites and continuing to grow. So clinics do have to meet some criteria, and I think, as Heather mentioned yesterday, we also do need to make sure that we've got a champion clinician in that clinic who can really understand how to treat NF as a multidisciplinary disease. So some of the characteristics of our current clinic network to date. So in 2023, our clinic saw over 21,000 patients, right? And there's the breakdown that you can see. Certainly the majority is NF1, but we do have that diversity from a perspective of NF2 related schwannomatosis and schwannomatosis. As you can see, 74% of our clinics are seeing pediatric patients. 8 clinics provide almost exclusively adult care. But we know that that's not enough, which is why we're up here today talking about why we wanted to create an adult pilot clinic program. And you can see the breakdown in terms of our care, medical genetics, neuro-oncology, pediatric neurology, and all but one clinic are involved with training and teaching activities, which is really important. We also want our clinics to provide clinical trials, and I think that's one of the things for the future, that we want to make sure that our clinic networks are also clinical trial sites, because that's a huge important part of how we're going to get more drugs to market. So the clinic itself formed 15 years ago, really, really beneficial. I mean, I think most of you who see clinicians in the clinics can say that, right? I think that for us, being able to ensure that we're providing standard of care across the country and ultimately across the world is hugely important for us as the leading organization in NF research and in NF care. But we know that there's still a need for additional NF centers, and that's one of the things that the NFCN, or Clinical Care Advisory Board, really looks at and takes incredibly seriously. And certainly we need to integrate more adult care into our clinics, or whether that's making sure that the pediatric clinic, that there's an adult clinic nearby so that there is an easy transition. And of course, our majority of our NF clinics promote our NF educational events. They should do family symposiums, but they'll have our brochures, and you can learn more about the educational activities and opportunities to be a part of the registry at the NF clinics as well. So you may be curious as to why CTF decided to create a pilot program around adult clinics. Well, there's certainly a need, and I know that there's a number of people in the room today who I'm incredibly grateful for bringing that need to our attention, many of our donors who are here, who are helping to spearhead these efforts, both in Los Angeles and in Arkansas. But if you really think about it, 75% of our population is actually adults with NF, and when you're 18 years old, if you're aged out of care, and we're lucky, many of our pediatric neuro-oncologists will still see their adult patients, right? I know, Tina, you certainly do, but that's not the case everywhere, and I think you're going to hear one of those stories in a little bit. And we don't want our adult patients to just not have care or not be seen. And when I think about it, I think how complicated is our health system to navigate in any event, where if I was a patient with NF, I can only imagine how scary that would be to be left on your own to figure this out, particularly when you need multidisciplinary care and you might not know where to go for that. And then, certainly with NF2 and schwannomatosis, a lot of our adult clinics, that's what they do focus on, are those that are solely focused on adults. But it's multidisciplinary, and we know that. And we know that young adults do experience different issues that need to be addressed, right? There's the issues of, I want to get married, I want to have children, health insurance, increased risk of cancer, and just that continuity of care. And I know that young adults don't want to be seen as pediatric patients. I actually think I was sitting at a table the other day where somebody was 23 years old, but they didn't want to be with the younger adults because they were 23. There's a big difference there. So what is our adult pilot program? So we've started it in two areas. We've started it at UAMS and at UCLA. We did that for a number of reasons. One, there's a little bit of diversity in population, but both of them also actually have a pediatric clinic nearby, so it makes it very, very easy from a perspective of transitional care. Additionally, we had great clinicians, and we had champions in those two centers who really, really wanted to support. And not only did we have champion clinicians, we also had champions as families and donors who wanted to support this. And so the two together really came at the right moment for us to really build this out. Now, it's taken us about 2 years to get it where it is today, and we've just started the seed funding process, but we're really thrilled, and we want to use this as the ability to grow adult clinics across the country. So what will it ultimately do? It's going to provide salary support, mentorship. Tina and Justin here are mentors to our lead clinicians at UCLA and UAMS. It's going to help us understand some of those additional unmet needs, perhaps even collect some data along the way, but really allow us to look at what could a continuum of care be for adults? What really should that transition program be? And certainly the goal is to create new NF clinics and bring new NF clinicians into the space. I think at UAMS, Dr. Erica Santos-Horta wasn't a part of our NFCN. She was, I forget exactly where she was. I think she might have been in Michigan. But she has this passion for NF, and she's just brought this vigor and life to the adult program. So we're really, really excited about that. And of course, we want to provide continuing medical education and mentorship to the clinicians who are driving forward these pilot programs. So this is just another way to look at this in terms of a multifaceted approach. This is a 2 to 3 year project. We're seed funding each at about $500,000. So it is a $1 million investment for CTF, and that's a large investment, and we are raising those funds as we speak. I think we have over 400,000 committed just to date. We know that there's much more on the way, but that's to date. And we just, I think, launched the program in, I think it was back just this past November or December, this past fall. So with that, I'm going to open it up into our panel discussion. And the first thing I'd like to do is have each of them introduce themselves, tell a little bit about their role in the program, and what having clinics focused on adult care means for the NF community. So I'm just going to go down the line, and I'm going to start with you, Justin.
Perfect. So thank you very much for the invitation to join today. My name is Justin Jordan. I am an adult neuro-oncologist at Massachusetts General Hospital, and I am the director of the neurofibromatosis clinic there as well. And I think that adult NF-specific care is critical. Obviously, that's why I'm involved in this. And I think it's critical for a few important reasons. Michelle sort of talked about those a little bit. Am I going on? Did you want me to?
No.
Yeah, okay.
You just started.
Michelle mentioned a few of those important things, but I tell patients, there are guidelines that help us understand the best approach to a patient with NF. Even a patient with NF who has no cancer history, who has no history of bone-related problems, but may be at risk. And so making sure necessary screening is followed throughout the lifetime is important. But secondly, I think that looking at one's entire health through the lens of NF is really important. And so I'll tell my patient, you may be diagnosed with high blood pressure, and your primary doctor may start you on a medicine for that, and that's fine, but I want to hear about that as well as everything else that's happening to you, because it could have something to do with your NF, and let's think about it specifically through that lens as well. So that's sort of my driving force in trying to make sure that patients get the very best care, even when they become adults with neurofibromatosis or schwannomatosis.
Hi, I'm Joe. I'm on the junior board for the Tumor Foundation, but also I'm an NF1 patient. I was diagnosed when I was 1 year old, and I'm 32 now. But I spent a lot of time at Children's Hospital as a kid with Dr. Rosser here, and they were fantastic years, care-wise, not fantastic in terms of health. But when I turned 26 or 27, I think, 26, correct? When I graduated from hospital, finding adult care was really difficult, to put it mildly. Like the old adage, an NF patient who walks into a doctor's office knows more about the disease than the person treating them. But so, like I walked into one place, and the whole time the guy talked like this. The doctor looked like he was half asleep and wanted to operate on a stable tumor right away. And so for a long time, we struggled to find a good adult care, even in Los Angeles. We ended up at UCLA. We've had some great care. We're hoping to now make it even better with a clinic we're funding there.
That's very well said, Joe. So yes, I've known Joe since he was like this tall. I don't know, 8 or 10 or something, so we've worked together for a long time. But I'm Tina Rosser. I'm a child neurologist, and I work at the Children's Hospital Los Angeles. We're actually affiliated with USC, so University of Southern California. Not to get confused with UCLA, but we do have very strong ties with UCLA through our work with NF and the NF Consortium together. But I'm honored to be here today. I think this is an extremely important topic. I think I speak for all the geneticists and neurologists and pediatricians out there at children's hospitals and in community practices who really want their adults to transition to a center of excellence, a wonderful place where their patients can get multidisciplinary care. I think Joe is a perfect example of what happens is that patients turn 21 and we can kind of stretch out their care at a pediatric center for a little bit, but at some point I can't take care of adult issues because while I can see patients, the orthopedist won't see the patients who are over 21, neurosurgeons can't see them over 21, the oncologist can't see them over 21, so you kind of tap out when you need kind of more complicated care of the specialists that can see them, and it's very hard to find in the community people who know about NF and who can collaborate together, which is why it's so important to have one place where patients can have their care centered, where all the doctors and providers can talk and really help maximize patients' care and their quality of health. So I am fully supportive of these efforts and super proud that the CTF has taken this on. And we're ready to make patient care better.
Love it. I am Katie Holt. I'm from Mayflower, Arkansas. I have NF1. I just joined the junior board. And I am so thrilled at the idea of having these adult clinics. So kind of like Joe was talking about, I aged out of Children's Hospital as well, but I aged out, right at that age limit. I went 7 years without care, and then I attempted to go to general neurology, and they are fantastic. I love neurologists. They are so brilliant. But the standard of care that you get when you have a multidisciplinary clinic that is specifically for NF is so pivotal. It's incredible because you don't have to think, oh, I forgot I need to go see ophthalmology, or I need to go see this. They have it already. They ask you, have you done this? Have you done that? And they take care of NF as a whole, not just as a piece, as a whole.
So Katie and Joe, I have a question for you because I know it's probably very pertinent for many people in the audience. So, if you, luckily, you now have access, Katie, and you both now have access to an adult clinic. But if you didn't, how do you advise to advocate for yourself if you don't have a clinic in your area? What would you tell other people in the room?
Speak up, always speak your mind and say your piece. For example, one of the hospitals I tried out shortly after leaving Children's, the surgeon wanted to operate on a tumor that had been stable for years when he saw it on a scan. My family had to say to him, no, listen, this tumor hasn't grown, it's been there for at least 8 years and hasn't moved at all. We don't need it operated on. Or making sure if you need to see a doctor, talk to them on my chart. Like, perfect example right now, I need a medicine infusion for a thing I'm undergoing right now. And I keep having to my chart message and call the doctor's office because it's taking a long time to get it done. So just making sure, especially as an adult, it can be tricky sometimes to remind yourself that you're the one in the driver's seat. But making sure you always kind of speak up for yourself and your needs.
Absolutely, I agree 100%. I always have the philosophy of never letting no be the final answer. So in that span of not having the clinic care, of course we have the foreknowledge of NF, you're at higher risk for breast cancer. I think it's like 40% or something at a higher risk. And I presented that to one of my doctors and said, hey, I need to start my mammograms at 30. I gave them probably 20 pages of research, and they said, absolutely not. No, that's ridiculous. We're not gonna do that. So don't be afraid to fire your doctors. Don't take no as the final answer. You know your own NF journey. You know your body. You know where you're at. And being able to say, no, I disagree, and move forward and go somewhere where you will get the level of care you deserve.
And I think there's quite a burden on a responsibility on the pediatric, medical system that is transitioning these patients out into the real world. When I know a patient is really going to leave, we have a conversation about, these are the things that you need to watch for with your body. Please know that I'm always a resource. Any doctor anywhere can always contact me. You can always contact me. We just want to make sure you're getting the best care that you can, no matter where you are. Because realistically, we know not everybody's going to be able to go to a center with an organized system like this. But, for us to just make sure that our patients are kind of being handed off and being educated in what they need to watch out for their bodies and how they can get in touch with the appropriate doctors, I think is really important too.
So Tina, that sort of was leading into my question that I was going to ask you, which is, talk about that tie, like the importance and that handoff and that transition, and why having the two clinics working together is so vital for this particular project to work so well.
Yes, it is absolutely essential, and we're very fortunate that we have a very strong NF clinic coordinator on our end, and UCLA has hired a new clinic coordinator on their end, and they've already been in talks from the minute that we set this up of, how are we going to organize patient care, how are we going to get patients transitioned. It's very challenging often because the insurance may need to change, you have to get together all your medical records. You may have complex MRI scans that need to get transferred. So, it's really just being organized in that, making that transition smooth. And I think it's, we still have some kinks to work out, but that's really what is going to, help make patient care work in the long run. And just having a really good, strong collaboration between those teams is really important. And Justin's on the receiving end, so he probably has some comments too.
I can say on the receiving end, I am fortunate to have Boston Children's Hospital in the city, and so we do see a relatively small number of pediatric patients in my group, and then Boston Children's Hospital has a larger pediatric population. And we communicate directly about patients transitioning, and that is just so incredibly helpful to know the concerns that are on the clinician's mind in the pediatric clinic, and make sure that we can take that baton and make sure we're on the same page. And I can compare that to patients who come out of the community, not transitioning from an NF clinic. Many people, as Katie described, find themselves just sort of without specifically NF care for many years, and then come. Usually it's when they've found a new life partner, or maybe if they're pregnant, or various other things that sort of transition in their life. They want to make the longer drive it may take, or they're finally reaching out for adult care that may be less convenient for them. And those are incredibly challenging to pick up the pieces and understand what happened 10 years ago, and when was the last time you had an MRI scan, and so forth. So the transition piece just cannot be overemphasized.
Justin, talk a little bit about, and Tina, you can probably add to this too, sort of the current state within the NFCN and the Clinical Care Advisory Board, the current state of guidelines for clinical care, whether that relates to where we are overall or even just on the adult side of it.
So in the greater medical community, having a standardized approach to medical care likely improves outcomes. And in many places in medicine, formalized guidelines are derived based on evidence that comes out of clinical trials or certain studies. In the NF and schwannomatosis worlds, we have less data-driven studies that have asked the question, for instance, is it better to get mammograms or MRIs of breasts for early breast cancer detection, as an example. And so what we have, rather than sort of data-driven guidelines currently, is expert consensus documents that recommend the right care for patients at the right time in their life. And those are incredibly helpful, and I think are the best level of care that we can provide in NF and schwannomatosis currently. And so to your point, Michelle, there are a couple of things going on, continuing to try to improve care for patients with both of these diseases. First, we're trying to increase the data behind these documents and try to get to actually formal guidelines that are developed as a consensus across physicians around the world, so that we make sure that we're getting the very best level of understanding for all of the experts who treat these diseases, making sure that we're getting that level of care to every patient with NF and schwannomatosis. And the second is there are a couple really important projects going on trying to empower patients to advocate for themselves. So recognizing that many patients may not be able to go to a center of excellence. There's a lot of work being done through certain research grants to educate patients and their local community providers on the current best care for NF and schwannomatosis, so that even if you can't come to an NF Center of Excellence, we can still try to increase the likelihood that you're getting good care.
Tina, anything you want to add to that? And thank you, Justin.
Yeah, no, I agree. Just as a clinician, it's very helpful to have published guidelines on how we can best take care of patients and share that with the pediatricians who are taking care of patients, and certainly as I transition adults, to kind of educate them on what kind of the best practices are that we, as best as we know them. Yeah.
So Katie and Joe, a quick question for you. And can you sum up in just a few words, like what's your experience now being in a adult clinic that's multidisciplinary?
For me, excellence. excellence is probably the key word, and critical, like Justin was saying. Just what you achieve there as a whole is incredible.
Yeah, for me, it's also fantastic, and the care is so much greater than I've had since I left Children's, to be able to know that everyone, like even my eye doctors, know a lot about NF and what to look for. And they have to see me every year as opposed to every few years, like what to scan my eyes and everything that I have to look out for.
So I have one more question for each of you before we open it up to the audience. Your hope and vision for this particular project, like where would you like to see this go? Justin, we'll start with you.
Probably to the detriment of many around me. I'm sort of a pie-in-the-sky person, and so, I mean, in reality, everybody with NF should have the ability to see an expert across their lifespan, and I think that we are embarking on an important journey to let that happen. It's also worth noting, telehealth obviously was increased significantly in the midst of the pandemic and the federally recognized public health emergency. There is a lot at stake for some of the telehealth flexibilities to go away at the end of 2024. And so for those of you who are inclined to advocacy in a federal level, this is something that I continue to talk to my representative and senators about, and hopefully many others here as well, so that those flexibilities can continue to allow people to see their NF doctors from afar. But I would say we should be working diligently toward the very best level of understanding of best practices for patients to get guidelines as good as possible, and for us to increase access to adult level care for every patient with schwannomatosis and neurofibromatosis across their lifetime.
Yep, and I think this project really is sort of laying the roots for what I hope is going to grow into a beautiful tree of network of, adult clinics that can sprout out over the country. There are certainly many challenges. I think one of the main ones is finding people to run these clinics and who have the passion for NF. That's the part of our jobs that Justin and I really enjoy, and Dr. Klesse, who's going to come up and talk in a second, is really, inspiring a love of NF and the NF population in all the people that we touch, all the people that we train along the way, all the folks that we interact with, so that they feel that they could carry the torch on. I was just talking to Dr. Listernicks, who some of you may know, who is, sort of thinking about how he's going to pass the torch on and inspire new faculty and young folks to kind of take things over when he ultimately retires. And I think, there's just going to be this beautiful pipeline, hopefully, of developing these clinics, and the CTF is fully behind this, and we're really looking forward to a network over the years to help patients.
Joe, Katie?
Just to also, like it's been said so far, just expanding the network of NF care, more adult clinics, but also one thing I hoped from all of this is to make, a whole campaign to make NF visible. It's like get to the point where that's not needed anymore, and where just NF is a common thing that everyone knows about anyways. I'm hoping that the clinics will eventually lead to more NF visibility too.
For me, my brain automatically goes to actually looping back to the children and their families, so that they have the knowledge and comfort of, I don't have to worry about this transition. I don't have to worry about hunting down doctors that'll listen, because I already know I have that access to care.
That's awesome. So do we have time to open it up for questions in the audience? I'm looking to see if we're beyond time or not. So why don't we have are there questions in the audience?
So, my name is Mercedes, and obviously I have neurofibromatosis. Where I live, I'm the expert. We have no NF doctors at all. Luckily, I found a dermatologist that's knowledgeable, but That's the extent of NF care that I've gotten, is my dermatologist removing the problematic ones. Is there any hope ever to get NF clinic type things, even if it's a mobile one that comes once a year in some of the more rural areas? Because there isn't one where I live. My friend Jen lives in Wyoming. Valerie. Jen's right next to me. There's Jen here. We don't have access. There is no NF clinic within 100 miles. More. Yeah, that's probably where there would be closest for me. And it's not feasible. It's out of network, so insurance is not going to pay, what it is. So there's nothing. Is there any hope to get anything like even a mobile one?
So my answer for you, Mercedes, because this did come up yesterday, and Kate and I were talking about it after the fact. So I would suggest getting in touch with Kate. We can't make any promises, right? But what we can try to do is ensure that your care is where you are, right? But that we can connect you to a physician like a Tina or a Justin who can help ensure that you're getting the right care and that you're asking the right questions, because we know that all of our nephrologists and all of our doctors at clinics are willing to help in care, particularly when a patient can't travel, right? It's very, very difficult, and we know that. And I know that when you look at the map, it's all on the East Coast and all on the what looks like more populated areas, and there's very little on the West Coast. And certainly we're looking at how do you change that. But I think definitely be in touch with Kate, and we can try to help you with that so that you don't have to worry about the cost and expense, but that you are getting the same level of care and expertise that somebody like a Joe or a Katie may be getting now. So.
We do have a question in the Hoover app that we wanted to bring up. Someone asked, what age does a young adult fully transition to adult care?
So generally in the pediatric hospitals and medical system, it's 21. Some providers will stop seeing patients at 18. I think it's probably institution specific, but generally 21. And I've been very fortunate at my institution. Like, I still take care of some 40 and 50-year-old patients who definitely need to be transitioned over to UCLA, but I think that also, again, speaks to the need for this, in the community.
One other thing I'll say is sometimes, like when I was at Children's Hospital, I was transitioned out gradually. Like, I stopped seeing my eye doctor at, I think, 18.
Yep.
I'm not positive, but then I got to still see Dr. Rosser until I was 26 or so.
But I think even with the establishment of this program, as patients, and the transition part does not start when you're 20 and a half. The transitioning actually starts when you're a teenager. So 16 to 18, you start talking about, one day we're going to transition you. These are your doctors. You need to know your medicines. We educate the patient. We educate the family. And as you move closer and closer to 21, we start having those conversations with the other center on the other side. We prepare a letter that sort of says these are the major medical problems. We help you get your medical records together and then begin the transition. So I think now, once we have this clinic set up, transitioning really will happen at 21 to 22 and not 26 or 27. Joe had very fragmented care. I'm sure he doesn't mind me saying.
Not at all.
Fragmented care between 21 and 26 or 27 because he couldn't see all the specialists at my institution, and it was really tough. It was really tough until we could consolidate everything at UCLA.
I think your name, the one on the far, you spoke about breast cancer and MRIs, breast MRIs compared to a mammogram. Breast cancer runs in my family, but it just seems like every time I go to the doctor, because of the density that I have, I'm sort of pushed off, and they don't suggest a breast MRI. What's the difference, and which one do you suggest?
There's no data yet for which is best in the setting of neurofibromatosis, which has an increased risk of breast cancer. So I use it as an example because it's a burning research question. I think that really there's a desperate need to determine is mammogram equal to, better than, worse than breast MRI for screening, especially young females with potentially dense breast tissue for tumors? But there's no best answer to your question, unfortunately.
And Justin, my doctor actually suggested alternation, so doing an MRI and then going to do the mammogram every 6 months, alternating. So.
I am a father of an adult son with NF, and he has his care at a major university center, and the primary care provider, who's excellent, said, "I know very little about NF. Let me send you to specialists." So his care was fragmented for a long period of time. I have not a question but a charge to you all, and that's to talk with your colleagues and think about how best to get those guidelines you spoke of to clinicians. And one way to do that, I think, is to make sure all patients with NF know how to access those guidelines.
It's a great point. Thank you very much.
Yeah, I'm not sure if those are available on the CTF website.
It's a good question, but we
But
can.
that might be
I
something
think,
to look
yeah.
into, to have a,
I think that's
yeah,
a
an
great,
area on the
it's a great
website
idea.
where all of you can actually download the relevant papers to share with your primary care physicians. Because sort of in my mind, if you don't have an NF center, you really probably need to find a good primary care doctor who can partner with you and sort of learn the guidelines and, you know, reach out to adult clinicians. And yeah, I'm not sure if Justin has different thoughts about that, but that's what I always tell my patients who haven't had access to a center prior to now.
I think that's exactly right. We probably, as the Clinical Care Advisory Board, should go back and look at what is available online and make sure that there's patient-friendly information available related to the published guidelines right now. Thank you, sir.
And you could also, I think, at the general CTF table, which I believe is being staffed by members of our science team, you can also ask them if we can pull it down. And I know that we may very well have guidelines for the new NF2 related schwannomatosis as NF2. I'm not sure if there's also the guidelines for NF1 that we have out there, but definitely ask. And if it's not, we'll make sure that we can get it too, without a doubt.
Katie, hi, it's Amy. I've heard you speak about this a few times, and so we've mentioned multidisciplinary care a few times. Can you, as a busy mom, can you talk about just really quickly like the practicalities of how this has changed your life? Because I think it's really powerful when you explain what, in real terms, what multidisciplinary means and what that means in your life when you're busy and you're working and all of that.
Sure.
I think that would be helpful.
Yeah, absolutely. So transitioning from not having a multidisciplinary clinic to having it, before, as you all know, you have appointment, and then 2 weeks later another appointment, and then 3 weeks later we're going to drive an hour to go to a different appointment. And having them localized and consolidated into a single day means less PTO off of work, more time with your children, more time with your family. And also, I mean, we all know about scanxiety. Having it all localized means less anxiety around, oh my gosh, I have this appointment, what's gonna happen? What are we thinking? Oh my gosh. So having it all in one place at one time, consolidated, has been tremendous.
Does anybody else want to comment on that question? Joe?
Just how easy it is to, same thing, it's also not having to drive far for me, thankfully, but to have all of my doctors together, or something's going on, for example, on my chart, my NF doctor, who seems to be primarily for my NF, because I'm also fighting a cancer right now, that sprung up from my NF, but my cancer doctor can make a note, and my NF doctor can also see it. Or if I go to see my eye doctor, my main NF doctors can also see it, so everyone can see what's going on with me all together. And just how easy and great that all is.
I will say, from the clinician side, I've worked really hard over the last decade to cultivate the specialists that I work well with, that we can connect about a patient and have relatively similar sort of ideas about that approach. And that feels really nice in one center. If a patient wants to see somebody that I don't know, sometimes I worry that they're going to want to operate on a tumor that's been stable for many years, or those various aspects. So I think that's sort of from the clinician side, having that multidisciplinary aspect at home is really helpful too.
And I always feel like it must be very reassuring for the patient to just know that their care is coordinated, that their doctors are talking, and that they're following guidelines. It just must be very reassuring to help you sleep at night for a little bit.
It does.
Yeah.
I think this is definitely, I can see coming away from, or myself, I'm coming away from this saying, oh my gosh, how are we going to raise enough money to make sure that we're driving adult clinics in other parts of the country? And how do we find these great NFologists and the clinicians like Tina and Justin who really care about this, because it is so important for all of you to make sure that we get you the best care. That's part of what is CTF, part of CTF's mission as well. So I think we are probably at about time. I probably ran over. So I want to thank our amazing panel. And now I'm going to introduce Laura Klesse, who is going to talk a little bit about our tiered program within the NF Clinic Network. So thank you all.
Okay, guys, I can be pretty quick. Maybe. There we go. Okay. So I'm Laura Klesse. I'm going to just talk a little bit about a proposal about changing our clinic network designation. So you've heard a little bit about the clinic network. I just want to give you a little background on how somebody becomes a member of the clinic network, and then what we've proposed to go forward. So in order for a clinic to be accepted into the clinic network, the clinic director, who has to be pretty committed, fills out an application. And that application talks about the clinic population, their focus. They've identified a team of subspecialists that all are also committed to NF, and then also outlines, hopefully, a transition of care to at adulthood. And then that application is actually reviewed by 3 members of the Clinical Care Advisory Board, and they often come back to clinics with recommendations about how to strengthen their program and then accept them into the program. What's helpful for the clinics is it does come with some potential for funding for patient education, putting on symposiums, and then for the clinic director or member of the staff to come to this annual meeting. And each year the clinics fill out an annual report that basically updates, is anything dramatic changed with your clinic. And then all affiliate clinics then are listed on the website. And so I don't know if any of you guys have looked at the website. The website actually has a ton of information, so you can actually search for clinics based on location, type of NF, or some specific diagnoses. The downside to this is then it's often difficult to tell who sees mostly adults, who sees mostly pediatrics, and if you're looking specifically for diagnoses, they're not always specifically clicked by the clinics. So I'm putting up my clinic in Dallas as an example here. But if you click on the clinic itself, you can see basic patient numbers, you can see the list of what they identify and whether they see adults or not. But like this group has talked about, a lot of the pediatric clinics will list that they see adults because they can see people into their early 20s, but they don't see patients potentially through their entire lifetime. And so it makes it, I think, quite frustrating for patients and for clinicians as they try to find ways to transition patients or identify clinics for patients if we haven't very clearly outlined who's a pediatric, who's an adult, who's more specific to NF1, who's more specific to schwannomatosis. And then the second limitation is we've never really very clearly outlined what's required for inclusion in the network. We ask you to fill out all this information, we review it, but we've never said this is what we'd really like a clinic to have to truly say that they're focused on NF care. And so the Clinical Care Advisory Board has actually proposed to now kind of change our system so that we designate clinics separately for NF1 or for schwannomatosis. You can be both if you care for patients with both, but really to highlight that difference to try to help both providers and patients find appropriate clinics, and then also designate clinics as either specialty programs or comprehensive programs. And this is based on a number of factors, and I'm just going to show you a quick, we've put together, sorry, my thing is slow, kind of the basics of this. So an NF specialty center would basically be the equivalent of what our clinics are designated now. So you show a commitment to NF patient care, you have a director who is committed to ongoing knowledge on NF, you have a clear transition plan to adulthood, whatever that may be, and that you know about ongoing trials so that you can refer patients. And then what we've done is say, we think for you to be a committed NF clinician and to know how to treat NF, you should be expected to see about 50 patients with NF1 each year and about 12 unique schwannomatosis patients each year. A comprehensive center will have all of those as well, but will be those centers that have more on-site NF-focused research, have on-site clinical trials or are ready for clinical trials, are clearly showing ongoing research with NF, with publications, national presentations, are committed to patient education, putting on those symposiums that CTF is willing to fund, and then really have that broad range of specialists that are needed for that multidisciplinary care that we've talked about. And the patient numbers we kind of expect clinics to have for this are about 200 patients each year for NF1 and about 25 for that schwannomatosis comprehensive. And so we put together, I know it's really small, but they've put together kind of this outline of how we expect clinics and each of the groups. So really we're looking at patient care, ongoing education, research, and have put each of these with these kind of different designations. So our goal is actually to start this year. Each year we ask the clinics to fill out their annual reports. We're going to put all of this kind of checkbox as much as possible in those clinic reports so that then we can give these designations and those will then be on the website to make it easier. Now, the CTF will review these, will designate clinics, will of course always have kind of ways to review those within the CCAB, and then all new applications will continue to be reviewed by the board. And so our hope is this will be up on the website by early next year. So the goal is we want to improve NF care. We want to improve the ability for patients, regardless of where they live, to have access to good care and to ongoing trials. And so we really hope as we kind of specify this more, we can improve that access and really help get clinics involved in this. So I'm going to stop there, and then I'm happy to answer any questions or if you've thought of other questions for our fabulous panel. Yes, sir. You want to yell? I'll try to repeat you.
He had a question too.
Name's TJ Warren. I just wanted to ask if a clinic is not checking those boxes, so they've applied and they're a part of the network, but they're not meeting those standards or check boxes. What takes place? What happens? Yeah.
So it's a great question and one we've talked about a lot because, our goal is to foster NF care. So we sure don't want to be like, oh my gosh, you're not meeting these certain levels, you're out. What we have really said is we're going to get the CCAB, the Clinical Care Advisory Board, involved. So those clinics we put on probation or just some type of what can we do to help you to get you raised up so that you are meeting those clinical care guidelines, you are getting those type of things. Because our goal is, right, we want more clinics that are involved and excited about NF care, and we really feel like our goal as the CCAB is to make that happen. So we certainly don't want to kick clinics out. What we really want to do is just get them to the point where we feel like that care is what we want it to be. Does that make sense?
We have a strong network of mentorship available through the CCAB, both through the pediatric arm and through the adult clinics too, for any clinic that might be sort of falling behind. Yeah, the goal is not to kick people out, but to keep them in and see what we can do to support them.
Yeah, because what we'd really like to do is not only do that, but you saw the picture of the U.S. where there are no clinics in huge states. What we really like to do is try to get people excited that we could identify providers to try to pull them in as well. Yes, ma'am.
Dr. Cleese, when I saw Dr. Lee at UT Southwestern,
Yes.
I like him. I need to go back to see him, obviously. I also would like to get involved in clinical trials. Well, I'm sorry, first, my name is Hank. So I did see Dr. Lee. I'd like to get involved in clinical trials. And I've also been wanting to find a new neurologist for a long time. I haven't been happy with her in a while. So if you could recommend somebody that's close to where I live, I don't like driving a long ways.
Yeah.
So that would be appreciated, but I'd definitely like to get involved in clinical trials.
Yeah, so let me get your information, or I'll give you my email, and then we can get you hooked in, because he's fabulous, so.
There's another question there.
One there and one
question
there.
Yeah.
So to kind of piggyback off that last question, Wyoming is one of those states, as we've talked. We have the lowest ratio of people to land with those numbers. How does that play out if the physicians can't feasibly achieve those numbers?
Yeah, so what's more important to us is somebody who's interested in NF clinical care, who has a commitment to it. So that's why they are our goal numbers, but they are not set in stone. So we definitely had this discussion that, right, we don't want to set one of those standardized test scores that keeps people out. What we really want are people involved. So we feel like there's a benefit to knowing who's really focused NF1, NF2, who has big, that broad subspecialist. If you have a specific problem that you need your physician to have someone to talk to, but no, we would definitely help work with those people, because that's just one of a number of criteria and nothing is set in stone. So I think that's a great question.
I just wanted to say really quick that we have to do a hard stop right now, but if anybody's got other questions, please put them in the Hoover app, and we will get someone either from CTF or Dr. Klesse or anybody else on the panel to answer them.
Okay,
Thank
thanks
you.
everybody.